to a new edition of the Indian Express Explained Live, our series of online explanatory conversations with domain experts and authorities on specific subjects. I am Monojit Majumdar, editor for explanatory journalism at the Indian Express. We think of Explained, the content in our paper and on our website, as well as in events such as this one, as being rooted in the. Am I audible?
Yes.
Yes. Sorry. So I was I audible right through, or I wasn't?
We just lost you in the last 5 seconds.
Okay. I'm sorry, everyone. Just the connection. So I was saying that we think of Explained, which is the content in our paper and our website, as well as in events such as this one, as being rooted in the news, but it goes beyond just the news. So it is essential context, it is background, it is connecting the dots, it is analysis. It is something that would help us all to not just know, but to also understand. Over the past year, we have all been consumed by this pandemic. And on this platform, we've had several conversations with experts who have helped us make sense of this changing, evolving, once in a century global health crisis. This evening, as we stand at a literally do or die moment, we are privileged to have with us Dr. Shahid Jameel, Director of the Trivedi School of Biosciences at Ashoka University, one of India's most distinguished virologists and chair of the Scientific Advisory Group of INSACOG. Dr. Jameel is also someone who has been among our most prominent voices of reason and knowledge over the past year of the pandemic. Thank you, Dr. Jameel, for your time. We are very grateful. Speaking with Dr. Jameel will be Amitabh Sinha, editor of the Indian Express's Pune edition and also the science editor of the Indian Express. Amitabh will begin with a short introduction, setting the stage for this discussion, after which he and Dr. Jameel will have an explanatory conversation for about 45 minutes or so. Thereafter, we will open the floor for some questions from the audience. Finally, thank you to Plutus IAS, our associate partner, who are helping us to bring to you this edition of Explained Live. Amitabh.
Thank you, Monojit. Welcome everyone in the audience, and special welcome to our guest, Dr. Shahid Jameel. Thank you, sir, for joining us. Before we start the conversation, I just have a small presentation to look at. So just to set the context of this conversation, I'll show a couple of graphs which describe the COVID situation in India right now. Those who have been following the COVID track, it's nothing new for them. They are familiar with this, but just to show you where we are. Now, this is the daily count of cases that we saw in April. We started somewhere around 80,000, and we went up almost on the last day of last month, April. We reached 4 lakh cases a day. This was the worst month for us during this pandemic. More than, I think, about 69 lakh cases were added in April itself. So this is the curve that actually completely debilitated us last month. Every day, and this is the phase that everyone seemed to be completely exhausted by. People were dying, lots of people were not finding hospital beds, and the cases were rising almost every day. Now, this is one full month. If we turn to next month, this is the curve so far in May. Now, it's not going down in a major way, but it's not the same as in April, as all of you can see. Things seem to be, although it's only 1/3 of the month as of now, you can see a little plateauing happening earlier, and the curve is very different. In fact, if we just go back to this slide, each and every day of April, each and every day brought in more number of cases. The case count kept on going higher and higher for each and every day, except these drops that you see on a Monday. As most of you would be knowing, Monday we usually see a drop in the number of cases, mainly because of slightly lower number of tests that are conducted on Sunday. So the drops that you see in between is on Mondays. So except on Mondays, each and every day brought in higher number of cases. That's something that we haven't seen even last year during the month of March at the beginning of the pandemic. This is something wasn't present even at that time. So the curve is looking like this. I don't know how much to read into it right now, but certainly it's not as dangerous looking as this one. Similar is the daily count of deaths that we had in April uh, last month. We started somewhere around 440, 450 on the 1st of April. We reached almost 4,000 deaths a day. That was on the last day of April. This has continued forward in May. This is how it looks in May. We did cross 4,000 deaths a day a couple of days in this month. But the upward curve that we were seeing in April, that does no longer seems to be the case. This, even if the cases begin to decline dramatically, say from tomorrow, the death figures would probably remain like this for at least 2 more weeks before we see a corresponding decline happening. So the death curve, no, this might look straight and flat, but we are talking about between 300 and 3,700 and 4,000 deaths, 4,100 deaths every day. So this is the current situation of the pandemic in India. Most of you are already familiar with, and this is what the uppermost thing on the minds of everyone is, well, when is this going to end? And this is what we will ask our guest today, Dr. Jameel. Welcome once again. Do you can anything be read in the numbers that we just saw in these slides, or not yet?
Well, firstly, thank you, Amitabh, for having me over, and must also thank Indian Express and you for all the opportunity you've given me to connect with your readers through the paper and now this. So what do those numbers tell us? Well, certainly the numbers tell us that we had a really devastating April. May, although the curve seems to have flattened out, but do realize that it has flattened out at a very high plateau. And it is not really showing, well, it's showing some signs of coming down, but I think it's a little too early to say much. If you look at the daily figures for, let's say, the 8th, 9th, and 10th, the last 3 days, we're talking about going from about 410,000 to about 366,000 to about 330,000. The figures for today, of course, are yet to come in, but at my last look, we had roughly 250,000 cases today around 4 p.m. So I think it's a little too early to tell. We have to wait for some time to see whether this downward trend, a bit of a downward trend that we see, is there or not. But at least it's not going up at the rate at which it was going. And many people may have realized when you were presenting that our figures in the month of April went up by 5-fold. We started around 80,000 and went up to about 400,000. The growth, if you look at the slope of the line, it was like almost a 60-degree climb for the line. which is really very, very high rate of growth. So in a way relieved that we have sort of reached a plateau, but I'll remind everyone that it's a high plateau. And we have to be very, very careful not to, really let it go any further, but to bend it down.
Right. So, as you mentioned, it's a seemingly we seem to have reached a plateau right now, at least in the few days that we have seen in May. We don't know how it's going to go forward from here. But the last time when we reached the peak in September, the decline began almost immediately. So there is a very sharp peak on 16th of September, and immediately the decline begins. This time, that doesn't seem to be the case. We are plateauing, and the plateau is fairly elongated. And it's true not just for India's curve, but at least in case of Maharashtra, where we have seen that this plateauing has continued for about 2 to 3 weeks now, without actually a significant decline happening in the case of Maharashtra. So does that also mean anything? How do we read these trends?
Well, I mean, one thing that immediately comes to mind is that we are looking at far more infectious variants at this time than we were looking at the first time around. I mean, the first time around, it was really, really a very, very, what should I say, gentle virus. This time we have a very formidable foe. The virus has changed, and that has given, sort of this curve. But don't let me sort of give you the message that it is the virus alone that has caused this mayhem. We allowed the virus to do this. I mean, the virus, of course, it came in the population and it infected people, and it will continue to infect people as long as there are susceptible people. The virus will continue to infect. But the point is that we gave the opportunity to the virus not to just spread, but to spread so quickly. And that has really led to this very, very sharp increase. The plateau, yes, the virus is still circulating, is still infecting. There's still a lot of susceptible people. So possibly that's one explanation why we are seeing such a wide plateau. And that sort of also tells you that the other side of the peak is not going to be an easy climb down.
Right.
It's possibly going to be a more prolonged, long drawn out process, running possibly into July, maybe even into August. We'll just have to keep an eye on it.
So that means even if the curve starts to decline, we will continue to have to deal with large number of infections every day. It's not going to come down in as steady a fashion as it did after the first wave, isn't it? So also, so this daily cases that we just saw, this is only one of the indicators. But what are the other indicators that you are looking at, which probably will give you some hope that, okay, things are probably going in the right direction for India now? What are the other indicators that you are looking at?
Well, first of all, let me go back to this question of, whether it's going to come down slowly or come down fast. Yes, in the first wave, we did see a steady decline.
Yeah.
But remember, even if the decline is similar this time, we are starting from a higher peak.
Very high peak.
Instead of 96, 97,000, we're starting from 400,000. So it will take that much longer. And during the process, at every time point, you'll have a lot of cases. So the worrying thing about peaks is that we are so focused on the peak that once the peak has achieved, we think, okay, job done. We've reached the peak. But don't lose track of what's the other side of the peak. Cases will continue to come. even 300,000 cases, even 250,000 cases per day is a huge amount of cases. That's still 2.5, 3 times the cases we had at peak in the first wave. So don't lose track of those numbers. Now, what are the other indicators? I mean, of course, from the point of view of the devastation that it has caused, mortality is going to be a very important figure to worry about. Uh, there is no indication that this mutant is any more lethal. Uh, but certainly, if you have 5 times more cases, you're going to have 5 times more severe cases and you're going to have 5 times more death, even at the same rate. So keep an eye on those figures. And I really think that the mortality data for India is completely wrong. Not because of some evil design of someone or a group of people or the state or whatever, but the way we record death, I think, is faulty. And uh, if you have, if you want to deal with that later, I can deal with that later. Why I think the death data is flawed. But just to stick to the discussion here, I think mortality is something we'll have to worry about. Recovery rates would be important to look at. And yes, of course, along with the recovery rate, the active cases.
Yep.
Remember, at one point, India's active cases were going up by about 7% per day. That was really at, when the trajectory was very high. So those are the numbers you have to look at, but they're all connected. They're really all connected. So if your healthcare system is not equipped to deal with the crisis, then the daily recovery will be less, mortality will be high. If the daily recovery will be less, then the daily active cases will keep going up. So they're all related to each other. But the real issue here is that this time around, the numbers completely overwhelmed the healthcare system. And we see it all around us.
Right. Dr. Jameel, since you mentioned the mortality numbers for India and that they might not represent the reality on the ground, I think let's address it right here before we forget it further down the conversation. I think a lot of people have been pointing out, and more so recently, that the numbers are a big underestimate, that the actual number of deaths might be very much higher. Now, there is no very good evidence to suggest by what amount would, I mean, how big the underestimate would be. And there are anecdotal evidence, and people are suggesting maybe it's 3x or 4x. The actual number is 3 or 4x times what is being reported, without actually, in the absence of any concrete evidence, it's anyone's guess. But if you suggest what is wrong with the way we count our deaths, maybe that can be one way to look at, and try to understand how big the discrepancy might be in the actual number of deaths that are recorded and the real number.
Yeah, so Amitabh, let me rationalize this by going to the natural death rate in India. How many people die of natural death every day? So the annual rate that Government of India reported to the World Bank and other organizations, the last rate that is available is for 2019. And in 2019, our mortality rate was 7.3 per 1,000 per year.
Right.
If you convert that into deaths per day,
Right.
that turns out to 27,600 deaths per day.
Right.
Now, if let's say we are having 4,000 deaths per day because of COVID, this number 4,000 is only a 15%, 15% increase over the natural deaths happening in India.
Right.
Now, with that small difference, you would not even notice it at crematoria,
Yeah.
at crematorium grounds, at burial grounds. Uh, but what you're seeing is a completely different picture.
Right.
You are seeing people waiting in line not just to get into a hospital, but actually for their loved ones to be cremated, to be buried. Uh, that can only happen when, even that system gets overwhelmed. So it will again be a guesstimate.
Right.
Uh, I would think that uh, unless the input at crematoria doubles,
Hmm.
we possibly will not see this kind of mayhem. And if you go by that logic, then we are looking at somewhere around maybe 5 to 10 times undercounting of deaths. Uh,
5 to 10 times.
yeah, and that is happening because even in the best of times, deaths are uh, not registered very well in the country, and
Right.
our registry is weak. Uh, but also that when the healthcare system gets overwhelmed, people are unable to get a COVID positive test. And I can tell you that this happened to a relative of mine who died uh, after being in the hospital for 10 days. And during those 10 days, until he died, his COVID result had not come. And this was in a town that has, okay, uh, reasonably okay medical, health services. So imagine what's happening. So this person was never counted as a COVID death.
Right.
I don't know what he was finally counted as, but there are going to be thousands of cases like this where tests don't come in, you don't count as COVID positive. Uh, Even somebody who's COVID positive dies of a heart attack would be called a cardiac arrest death rather than a COVID death. So this sort of undercounting is happening all over the country, and that's why I think the numbers are low.
Right. Dr. Jamil, the other question I think which a lot of people have been wondering about is, and you have addressed it partially, is how exactly did we land ourselves in a situation like this? We were supposed to be doing quite fine till the end of January. The cases were going down, and suddenly nobody knows what hit us. So. No, you have already mentioned part of the thing that we have ourselves to blame and probably the virus too. How much of it should we consider ourselves responsible for this, and how much of it can we just simply blame it on the virus that, oh, the virus actually mutated and it's nothing, we couldn't have done anything much about it.
Right. So, Amitabh, we are a cricket crazy nation, and there is, every budding cricketer is told, don't take your eyes off the ball,
Yeah.
right? We took our eyes off the ball. That's basically what we did. In the 5 months from peak in September to February, uh, you know, the cases were going down, and the cases were going down even at a time when we went through the festivals of Dasara and Diwali. And remember, in between Dasara and Diwali, we had the Bihar elections.
Yeah.
Uh, and all through that time, as the graph was going down, we and our leaders started thinking that we have conquered
Hmm.
COVID. But you just had to look around you. Every single country in the world that peaked before us was having a second peak before us,
Hmm.
a second wave before us.
Right.
But we were constantly fed on this narrative, and we started believing in that narrative that somehow Indians are special. We get BCG shots when we are children. We get a lot of malaria, so we get a lot of chloroquine. All sorts of arguments were there that uh, why Indians are so special, and that curve has gone down. Well, the curve, now looking back, hindsight is 2020. Now looking back, the curve had gone down because the virus strain was not as virulent. The second thing is that we were still observing COVID appropriate protocol. Remember, in the first wave, we were far more concerned about catching COVID than even at 200,000, 300,000 cases every day in this wave. Uh, so possibly a mixture of those two things. But then, what happened? By the time we came to December and the cases kept going down, we did start believing in this narrative. There were a lot of big weddings that we had in January and February. So let's say super spreading events happened. And these super spreading events are weddings that happened. Super spreading events are local body elections and state elections that happened in many states. And of course, the religious congregations. The Kumbh Mela is one example where lots of people gathered in one place. But remember, when this was happening, most of it was happening in February or so, February, March. We now know that a more infectious variant was developing. We spotted it first in December, but then it was really minuscule and very little attention was paid to it. It kept increasing in January and February. And that is when our sequencing also started increasing and we started detecting it more and more. So I would say that it's a combination. Let me just say that first we became complacent, and then this sort of variant virus caught us at the right time for the virus, wrong time for us. So, this together caused this mayhem that we're looking at. And finally, we when we had the opportunity to get vaccinated in January and February, enough of us did not get vaccinated. Remember, vaccination opened in mid-January. And by the time this peak hit us around the third week of February, when numbers started going up, we had very, very poor vaccine coverage. I mean, I have the figures here. By the time this happened, we had only about, how much? Just give me a minute. Yeah, we had only about 5% or less, possibly about 2% of people
Yeah.
who had vaccinated. So, all this together really caused this mayhem. Everything came together at the same time, really.
So it's actually good that you mentioned vaccinations, because that's another thing that a lot of people are concerned about. And again, the same question on how did we land ourselves in a situation like this with regard to vaccinations as well. Now, again, we were supposed to be the vaccine powerhouse, manufacturing powerhouse. We were supposed to have the largest manufacturer in India. At least last year, two of our indigenous vaccines were being developed. And somehow things seemed to be pretty rosy, or at least pretty decent for us at that point of time in December, January. And suddenly now people want vaccines. There aren't enough vaccines. There's terrible shortages everywhere, long queues to get vaccines. No one. A lot of people complaining that they can't get themselves registered or they can't find vaccines. Again, why? How did we land ourselves in a situation like this when we possibly could have done much better with regard to vaccinations, at least?
Yeah. So going back to mid-January when vaccination opened, and I must say that the government's program to vaccinate was a very sensible program, because you want vaccines to do three things in a pandemic. The first thing you want to do is protect your frontline workers, people who work in hospitals, people who work in situations where there is a lot of public contact, like police services and all that. Uh, the second would be to reduce mortality. And we already knew that people above 60 and people with comorbid conditions like diabetes, for example, were more at risk of dying. So that would be the second group that would get vaccinated. And finally, a pandemic vaccine is supposed to break the pandemic, turn things around. Now, when vaccination started for us, at that time we were constantly hearing a couple of messages. One message we were hearing was that Indians are special. We have conquered COVID. So therefore, it was very logical for most people to think, well, COVID is gone. Why should I take a vaccine that has taken only less than a year to develop, whereas most other vaccines have taken 10 years or more to develop? And by that analogy, people were thinking, well, maybe this vaccine is not tested enough, maybe it's not safe enough. However, many of us were, crying hoarse at that time that these vaccines have been tested for safety as well as any other vaccine. These vaccines are safe. Please go get a vaccine. Now, along with that, we had uh, sort of messages coming out of Europe that the Oxford AstraZeneca vaccine is causing blood clots. That was really the something that started coming out of Europe, but we did not pay attention to numbers. How many people were getting blood clots? And if you actually start computing the relative risk of dying from a blood clot after taking a vaccine, that risk varies between 1 out of 150,000 to 1 out of 330,000. Do you know what is the risk of dying out of a lightning strike? It is 1 in 140,000. So the point is that you are more at risk dying from a lightning strike than you are dying after taking a vaccine. And everyone thought in January and February that they would be the ones to die with a blood clot. And again, our messaging was mixed. We did not really say very clearly that that's not going to happen. And by the time vaccination was open to people above 60, I have so many friends, so many family members that really did not want to take a vaccine. I went around and took a vaccine. I mean, I got my first shot of vaccine in the very first week that it was opened for people of my age group. But many people are still not vaccinated. So what happened then? Why did we come to a vaccine shortage? Well, if you look at all the big countries, all the countries that have vaccinated their populations to a large percentage, all of them booked vaccine doses, around mid 2020. India didn't do that. We did have a big vaccine enterprise, but remember, our biggest vaccine companies are private limited companies. It's another story that going back a few years, we closed down all our public vaccine enterprises. So we depend entirely on the private sector. Private sector does not work on charity. Private sector needs to be given orders for them to be confident of, building facilities to make vaccines. And that is where we took our eye off the ball. They did get orders, but they got orders in January or maybe December last year. Uh, Serum Institute, for example, which is our biggest vaccine manufacturer, out of about 2.3 billion doses of vaccine that India makes, Serum makes roughly 1.5 billion doses annually of all vaccines. So they're the biggest. They got $300 million support from this international grouping called COVAX, and they had to commit certain number of doses to the COVAX program. They put $270 million of their own money into building facilities to make COVID vaccines. And our public vaccine distribution system did not give them any orders till December or January. Now, vaccines are not something that can be made overnight. And when vaccine orders were not there, vaccine supplies went down. We were a vaccine surplus nation. Remember, we were giving vaccines through our vaccine diplomacy, which is an excellent program. And, we really showed what India can do. We gave out about 66 million doses of vaccines to 95 countries. Roughly 10.5 to 11 million doses we gave free of cost uh, to neighboring countries. So, we were looking very tall as a nation. But unfortunately, taking our eye off the ball made us a country that is now importing vaccines. That's a tragedy. Yes, funds have been given. $400 million have been given now to Serum, 200 million to Bharat Biotech. They are expanding facilities, but it will take about July by the time vaccine supplies normalize. So yes, that's to, to me, sitting outside the system, I think that is what happened.
So, uh, tell me if I am calculating right. Now, we have about 2.1 crore infections that we know of. The last Zero survey, it showed that for every reported case, maybe there are about 25 to 30 cases that go unreported. Now, if we take that number, then the actual number of infections in India would be somewhere in the range of 50 crore. Now, 17 crore people have been vaccinated, at least with the first dose. The second dose is a much lower number. So we are now, of course, a lot of people in that 17 crore group. I mean, there would be an overlap between that 17 crore group and people who have already been infected. So a lot of infected people would have, but we are still looking at somewhere around 50 to 60 crore people that probably would have been infected by the virus till now, or would have gained immunity through the vaccines. That would be roughly that's more than a third of India's population, around 34-35% of India's population. uh, would that have a bearing on the way the curve progresses from here, and the flattening? We are not sure whether it's actually flattening, but it does seem so right now. Would that be a result of this particular number that we are talking about, roughly 30 to 35%, around 35% of the people in India having gained immunity?
Yeah, so a couple of things there, Amitabh. Firstly, people who got infected but had asymptomatic infection or a very mild infection, there is already data coming out that their immune response has not been very robust. So, to some extent, they would still be susceptible. And
Right.
if you recall, the figures were that roughly 80% people
Yeah.
had asymptomatic infection. So I would say that we still have a very large number of susceptible people, people who can be infected by the virus. Now, the calculations that were being done during the first wave suggested that once about 60%, 65% of the population gets either infected or vaccinated, what you call herd immunity would kick in. But now things have changed. Now you have a virus that is moving at least twice as fast, if not more. Uh, so what you need is, at least possibly 75% of population uh, to be infected or vaccinated before you can achieve what you call herd immunity. So it's a shifting goalpost right now. Uh, uh, Eventually, the virus will infect everyone who will remain susceptible. And that is why it is so important for us to go and get vaccinated as soon as vaccines are available to us. Now, vaccines are not going to do much to control the second wave, so to say, because if I start taking my vaccine today, it will take me at least 6 to 8 months for the effects to show. And by that time, in 2 months' time, the graph will be down at least 50%, if not more. But if we vaccinate at scale now, we will prevent future waves. We will mitigate, we will reduce the height of the next wave. We will increase the time between this wave and the next wave. If we had vaccinated at scale in January and February, and even in March, we would be bending the curve now. But that unfortunately hasn't happened. But that doesn't mean that vaccines have become useless. No, they're not. Vaccines still have a very, very important role to play from here on.
So now there's a lot of concern about vaccines still, and to a very large extent, there's a lot of misinformation also that floats around on WhatsApp and other medium, which people who are not very well versed, it helps it forces them to reconsider their decisions with regard to the vaccines. Now, how there have been cases of what are called the breakthrough infections, people who have taken vaccines and still being infected. And there have been several cases of even people taking their second doses and getting infected after that. Does it say anything about the effectiveness of the vaccine? Should it force anyone to reconsider their decision to take vaccines in any age group?
Yeah, so first thing about the messaging, it's very funny that people will believe a WhatsApp message from somebody they don't know over information from somebody they have known for years. And I have personally struggled with this because I have friends and neighbors who constantly keep sending me information about what so and so said. And I keep telling them that, look, you've known me for 20 years, 30 years. You don't want to believe me, but you want to believe somebody who you don't even know who has sent you this message. But I guess that's what we are as a species. We tend to believe sensational bit a little more than, we believe things that come with moderation. Nevertheless, coming to breakthrough infections, the first fact that we must all understand is that no COVID vaccine has made a claim that it can prevent infections. Whether it's your Pfizer vaccine or Moderna vaccine, AstraZeneca, Covaxin, Sputnik, no vaccine has made this claim that you will not get infected. In fact, there are very few viral vaccines that we use even routinely that prevent infection. Most vaccines will only prevent disease, and so does this vaccine. Yes, breakthrough infections are happening because A, the numbers are so high, and B, that we are in an environment where there is a pandemic, where everyone is sensitive to it. The moment you start coughing, you go and get an RT-PCR test done. Normally, that wouldn't happen. So yes, the breakthrough infections are being seen much more than they were seen earlier. But it is also a fact that every breakthrough infection that is happening, or at least a very large majority of breakthrough infections, are leading to either asymptomatic or mild disease, which can be controlled simply by staying at home and, taking the normal precautions. It's very rare that somebody who has had 2 doses of the vaccine will get into a hospital and go on oxygen and further. Vaccines have been tested against severe disease. They do very well against severe disease. They do very well against mortality. But breakthrough infections happen, they will continue to happen. So I guess we have not fully understood what a vaccine is supposed to do. A vaccine is supposed to prevent severe disease. A vaccine is not supposed to prevent infection. And going back to the common flu vaccine, the seasonal flu vaccine that uh, anyone who is above 50 should really be taking. I can tell you my own experience that when I was not taking the seasonal flu vaccine, I would get flu twice in the year, one at the start of the flu season and one at the end of the flu season. And every time it would knock me out for 3, 4 days, sometimes a week. Ever since I started taking the flu vaccine, I do get infected. I know that because I feel tired for a day, I feel like sleeping the day out, but the next day I'm okay. I never get high fever, I never get the disease. So that's how vaccines work. A flu vaccine protects me from disease. COVID vaccine will protect me from disease.
And there is no recorded instance that we know of in which a person who had taken both doses of the vaccine has died of COVID-19, isn't it?
Not to my knowledge, no.
Yes. So, and there are a lot of people, even amongst our audience, they also want to know, and we'll be progressing to audience questions now. So, but I've been looking at some of the questions that have been sent by our audience, and a lot of people want to know why are we not vaccinating our children as well? Why is the vaccines not open for children? In the United States, at least 16 plus, everyone is being vaccinated. Here, why it is 18 plus? And when the vaccination open for children as well?
Yeah, so the answer is very simple. The vaccines that have been tested on populations 18 and above. They have not been tested on people below 18. There were some limited trials, I believe, of one of the RNA vaccines that was tested on children between 12 to 18, but that's very limited levels of testing. So the vaccines that we are using in India have been tested only on people 18 and above. And therefore, it is important that we use those vaccines in that population. Uh, Unless it is tested on children, it's not advisable to open it up to children.
Right. Thank you. I think we'll just go to our audience questions. There are a lot of people who have been sending us questions they want to ask you. And we'll start with Mr. Kamlesh Nankani. Is Mr. Kamlesh Nankani here? You can go ahead and ask your question, please.
Yes, Amitabh, I'm there. Dr. Jameel, am I audible?
Yes, you are.
Good evening, sir. I have two questions. I am from Pune, Maharashtra. My question number one is Maharashtra, as Amitabh said earlier, the number of fresh cases, recovery rates have been improving for quite some time. Can we consider this as a flattening of the curve or decline, sustainable decline? The second question is there any linkage worldwide between percentage of population vaccinated and decline in COVID cases?
Yes, certainly. So, uh, your first question, whether what we are seeing in Maharashtra looks like a sustainable decline, I do feel that because the numbers have gone down consistently for uh, weeks, actually, not just days. But the second thing, and very, very important thing, is that Maharashtra is possibly one of the few states that are actually testing and reporting very well. Uh, I am I can't say that for many other states that they are testing at that level or they are reporting things as well as they should be reporting. Uh, so yes, I do believe that Maharashtra has turned the corner. Maharashtra has paid a very heavy price, but thankfully it has turned the corner. Your second question, and you're absolutely right. data that we see from countries like Israel and Germany, which have vaccinated very large fractions of their population, suggests that once you vaccinate roughly 40% of your population with both doses, uh, maybe about 50 to 60% with one dose, you start to bend the curve. Uh, we are very far from that yet. If you look at data from today, we have given 9.8% of our population one dose and 2.6% of our population both doses. At least that was the data at 4 p.m. today when I looked at it. So we are far from it, but let's hope that we continue to vaccinate at scale. And that's where, I mean, also I would say that it's a little disappointing that we had gone up to about 4 million doses every day in April, in early April. But since then, it's been a constant decline. And at this time, we are giving somewhere between 2 million to 2.5 million doses every day. That's not an adequate number for us to be vaccinating. We really need to be vaccinating at a rate of about 7.5 to 10 million doses every single day to be able to reverse things. And for various reasons, we're not able to do that right now.
So thank you, Kamlesh. I think I'll call the next from the audience. Mrinalini Fadnavis. Is Mrinalini here? Yeah, please go ahead.
Yeah. So good evening, sir. A lot of things has been heard about the use of natural resources in this pandemic. So my question is, are natural and eco-friendly methods more useful to restrict COVID?
Can you define natural methods?
like yoga, then different types of kadhas and things which is used in Ayurvedas, and different type of pranayamas, meditations, and all related things are more useful to restrict COVID.
Yeah, so I mean, definitely yoga leads to a more healthier lifestyle. And the breathing exercises in yoga increase your lung capacity, increase your lung health. So certainly it helps. And it helps in your general well-being. And if you eat well, if you exercise, light exercises, especially like in yoga, your general disposition is better, your general immunity levels are better, and you're less likely to be infected, and you're less likely that the infection will progress from your upper respiratory, which is your throat and your nose, into your lungs, where it causes most of the mayhem. So yes, certainly those things help. But if you ask me whether once you have been infected and you continue to do that and you will kill the virus, I would be skeptical of that. But certainly it's helpful for good health.
Okay, the next question would come from Jyoti Waklu. Is Jyoti around? Hi, Jyoti, please go ahead.
Hello. So I want to thank Indian Express for giving me this opportunity to talk to Dr. Jameel one-on-one. It's a privilege. Good evening, sir.
Good evening.
Sir, I wanted to make a comment. There is, and then I want to ask my question if I'm permitted to.
Please go ahead. Go ahead.
Sir, there was a news that Dr. Anilkumars Rawat from Saroj Hospital in New Delhi, he died after having both the shots, and the second shot he had in March. So since very less people are getting vaccinated and people are getting infections after the second dose, so I just wanted to know what could be the reason, like because people are different, they're bodily different from one another, because there are reports wherein people have had second dose and still they come to COVID.
Well, I mean, it's unfortunate that the good doctor died. I mean, any death is unfortunate. He had his second dose in March uh, and died now. Uh, Firstly, we don't, I mean, I personally don't know the details of the case, so I should not really be commenting on it. Let us assume that he he had COVID and he died of COVID. It would be a very, very rare case. And, medicine is all about risk benefit. Uh, and to give you an example, if you look at the polio vaccine, which has been a hugely successful vaccine, which has eliminated polio from almost the entire world. There are just 2 countries left where polio still exists. Even that successful vaccine causes what is known as vaccine induced polio in 1 out of 1 million children who are given the vaccine. So, yes, that one child out of 1 million is unfortunate. But when you look at a population level, a vaccine like that has immense benefit. So, without knowing the details of this case, I would go back and say, even if this was a COVID death after vaccination, vaccines are still uh, hugely beneficial compared to the risk. And these vaccines have not claimed that you will not get infection. But maybe this doctor got infected, but he had some underlying morbidities, he had some other underlying conditions. So we don't really know the case. So to just use that one case to say that since it happened to that doctor, therefore I would not go and take a vaccine would be foolish. And if I'm allowed to say stupid, we shouldn't do that.
Thank you, Jyoti. The next question will come from Sayantini Day. Sayantini, are you there? Yeah.
Yes, I'm there. Thank you so much for this opportunity. Thank you, Indian Express. And my question to Dr. Jameel stems from his observation that the countries which have seen their first and second peaks before India saw its first and second peak. I think many countries in Europe are undergoing their third wave. So I'm assuming that there will be a third wave in India also. So my question to Dr. Jameel will be, how bad will be third wave in India? And the second thing is that if we are not vaccinating our children, is it possible that our children will be more susceptible to the virus in the third wave? Thank you so much.
Yeah, thank you. I think these are all very good questions. What we know is that there will be other waves, not just the third wave, but maybe a fourth wave and subsequent. But it all depends on the conditions that we provide. If we vaccinate at scale now, we can reduce the intensity of the third wave, we can push it further out. Remember, respiratory viruses like this, go in cycles. And as they go in cycles, people build immunity and less people are exposed and get infected. And this is how the virus becomes endemic. So before I get to the main question, let me also say that, uh, you know, for a virus like this to kill you is not in the interest of the virus. Why do I say that? Because a dead host is of no consequence to a virus. A dead host cannot transmit the virus to another person. A severely sick person cannot transmit the virus to another person. What the virus really wants you to do, if the virus had a brain and it was thinking, what the virus really wants you to do is to remain asymptomatic and continue transmitting the virus. So the point of telling you this is that all viruses like this eventually evolve into viruses that cause very little illness. It will happen to this virus also. But being a new virus in the population, it is still in the process of evolving. And our own immune system is still in the process of reacting to it. So this is a war that is being fought at a population level inside each one of us, and that is what is causing severe disease or mortality. So it will eventually become a harmless virus. And in the process of doing that, we will go through these waves. So whether we have a third wave or not, it shouldn't be very surprising. I can't predict when we will have the third wave, and I can't predict how bad or how good it will be. I mean, it can't be good, it can only be bad, but I don't know how bad it will be. It will all depend on how well we vaccinate, how well we restrict the development of further infectious mutants, more lethal mutants. We have very little control over that. In a sense, we have control by limiting transmission. The more viruses transmit, the more they will mutate, the more they will evolve. Uh, so just limit transmission of the virus by getting vaccinated, and most importantly, by wearing a mask. We are worried sick about this variant or that variant, but we fail to understand that a good mask, will prevent every variant. So let us do that diligently, and we should be over it. Yes, if we're not vaccinating children, children will be more susceptible. Large populations of children will remain susceptible in the future. And that is why I think it's important to also start testing vaccines on children, and have the ability to give vaccines to children in the near future. It's already happening in the West, and I think we should be doing the same in the days to come.
Uh, Thank you. The next question will come from Chavi. Is Chavi here? Yeah, Chavi, please go ahead.
Hello, yes. Good evening, everyone. Sir, I wanted to know the exact mechanism through which a virus mutant might escape RT-PCR testing, and what enhancements will be needed in the test to not let that happen.
Sorry, I didn't get the question. Amitabh, did you get it?
Yeah, I think what she's saying is, under what conditions does the virus escape the RT-PCR test?
Oh, okay.
Am I right, Chavi? Your voice wasn't very clear, but did I hear you correctly?
Well, I mean, that's
Yes,
an
sir,
important
you are
question.
right.
Yeah.
That's an important question. So let me answer that. We are hearing a lot that PCR tests are coming negative and still somebody gets infected. Well, the way PCR works is that it detects the viral nucleic acid, RNA. And the way this works is that little pieces of nucleic acid, which are called primers, are first bound to the RNA, and then they are amplified. Now, if the binding site of these little units is mutated, is changed, then these will not bind and amplification will not happen, and you will get a negative test. That was seen initially when the UK variant came about, because the UK variant had a deletion, some nucleotides that were deleted in the upstream region of the spike gene. And that was causing the spike to be missed. But the two others were being picked. Those tests have been modified, and whatever we see in terms of sequences of the virus, there is no logical reason why PCR tests should be coming negative. So I don't think it is based on mutations in the virus. A more likely explanation is that since we have so many people coming down with infection or possible infection, testing has increased to a level where sampling is not being done properly. Remember, if the swab is not taken from the back of your nasal cavity or the back of your oropharyngeal cavity, you're not going to pick up the virus very easily. And if there are a lot of people who are doing the swabbing who are not trained to do it, then you will have bad sample picking, and that will come negative. The other thing that has happened is that while indigenizing these PCR tests, we have paid very little attention to quality control of the reagents. Uh, and poor reagents are possibly leading to poor PCR tests. So it's not happening because of the virus has mutated. It's happening because testing is not proper.
Thank you. Next question is from Anthony Kolanur. I hope I'm calling his name correctly. Please go ahead, sir.
Please unmute yourself.
So you are muted. Please unmute yourself.
Okay.
Yeah.
Am I clear?
Yeah. Please.
Audible. Okay. I am Dr. Anthony Kollanur, and I am a pediatrician from Kochi. My original question is partially answered, but I will ask a supplementary question. My original question was, how significant is the contribution of mutant variants to the second wave in India? Are they the only culprit? So you have explained all those factors apart from the mutant virus, but if you could say the role or the percentage factor, I would appreciate. But my subsequent question is in response to a comment that they said there is no clear data and a guesswork of how many are infected in the community vis-a-vis the cases reported. So my question on that front to Dr. Shahid Jameel isn't the ICMR February survey gives that indication of 21.5% seropositivity, which is almost amounting to 25 to 30 times of actual infection in the community. Isn't that's not a guesswork, I suppose. I wanted to ask you.
Yeah.
Two questions.
Yeah, so your first question, yes, I already answered it earlier. It's a combination of behavior and virus mutants. Now, how much of each I can't tell you. I can't tell you whether it's 50 this, 50 that, or 30 this, 70 that. I can't tell you that. But as I said earlier, we became complacent at the right time for the virus. At the same time, the virus was developing faster acting variants. And we now know, for example, this something that we call the Indian variant or B617. In populations in India where B617 and B117, which is the UK variant, in populations where these two were circulating at the same time, the B617 has overtaken B117. What does that mean? That means that the B617 is more infectious, more transmissible than 117. And if you recall, British authorities had already said that the UK variant is 50 to 70% more infectious than the parent virus. So going by this scenario, I would say that the virus that is now mainly circulating in India, the B617 virus, is possibly about twice as infectious. I mean, don't hold me down to that number, but I'm just giving you a ballpark figure. The second question, serosurveys. Yes, you're absolutely right. When the ICMR serosurvey showed that 21.5% of India had antibodies, and this was based on a sample size of about 28,000 people tested across 70 different districts in the country. At that time, if you look at the confirmed cases and match confirmed cases to potential infections, the factor was 1 in 15, 1-5. So if you go simply by that analogy, you can multiply today's figures by 15. But I think today's figures would be different because at that time when the ICMR serosurvey was done, we did not have a more transmissible, a more infectious mutant in the population. Now we have that. So the numbers are going to be, the ratio is going to be slightly skewed now. So yes, we can make some guesses, and so let's say anywhere from 15 to 25 times is the number we should be looking at.
Thank you. I would like to call Mr. Chandrasekhar from the audience. Mr. Chandrasekhar, please.
Can you hear me, sir? Yeah.
Yes, please. Go ahead.
Yeah. So I thanks first of all, because it's always pleasure to hear Professor Shahid Jameel. Now I have this doubt, as you have already mentioned, that deaths are highly underreported, and my institute, which is International Institute for Population Science, definitely may take exercise in future, because we comes directly under Ministry of Health. So at this claim, without any robust estimate, we cannot say how much is there. So my question is that one is, of course, cremations and burials are one, back calculation could be done later on. But Professor Jamil, can I just ask, because I am not in the virology, but the one is that as a direct death reported. Second is that those people who could not avail the services, as you said that, maybe 15% is higher as per this rate, maybe excess mortality, but it is much higher. But what I would like to say, even those people who could not access the services due to the, as they could do in normally, and life could have been saved, due to the COVID declaration, or most of the hospital were made COVID hospital, and that amount is very necessary to estimates, in my view.
No, you're absolutely right. I mean,
and just adding question to that, even the IHME Lancet publication, if you do back calculation, I just estimated that it is 6,000 ton on average is coming if death would be there 1 million by August 1. The second, the third is that as per our population estimates, I just was calculating from census, every month we are adding 20 million, 2 million, 2 million people in 18 to 44 age group every month. So if you don't speed up your vaccination, you can never achieve even next 5 year the 75% vaccination. You can imagine that. So how fast we should be than other countries, because their population volume is not that high and not that young. Thank you. I mean, you don't need to answer everything, but I'm just trying to say that your enlightenment.
So you have very valid points. I mean, I did put out a number during my conversation with Amitabh that we should really be vaccinating about 7.5 to 10 million doses a day to be able to really vaccinate everyone who should get a vaccine by the end of this year. So remember, this is not over the next 2 months or 3 months. I'm talking about over the year. So yes, vaccination at scale is very, very important. On the other hand, what we keep hearing are very disturbing, is some very disturbing logic. And the logic is that India has delivered the highest number of doses in the world. Well, the highest number of doses won't do any good because it has not covered enough population. And this has been a constant problem in this COVID thing in India. We count cases and deaths against per million population. But when we count tests, we give the absolute number of tests. And when we count vaccine doses delivered, we talk about absolute number of doses delivered. But we also have a very big denominator. I mean, India is a country with 1.38 billion people. Our denominator is huge. So when the virus is looking at you, the virus is not looking at how many million doses you have delivered. The virus is looking at what percent of your population has been vaccinated. So that's a key figure to keep your eye on. What was your other question? I lost track there.
I think he's
why he yeah. So he was talking about the death figure. So yes, again, we are so keyed on COVID. We don't know how many extra deaths are happening because of tuberculosis. We don't know how many extra deaths are happening because facilities are not able to vaccinate pregnant mothers and children. We don't know how many deaths are happening because somebody who had a heart attack could not reach hospital on time. All those things. Somebody who needed dialysis is not able to get dialysis. So all those things do add up, and they can be sort of thought about as not direct COVID deaths, but indirect COVID deaths, simply because the system has been overwhelmed. And all that counting will happen later, and all that is very unfortunate. But we have to deal with it.
Thank you. The next question will come from Deepak Rawal. Deepak?
Hello, am I audible?
Yes.
Amitabh?
Yes.
Yeah.
Yes.
Dr. Shahid, really appreciate your rational and valid research session. Let's say hypothetically you are heading the Supreme Court appointed task force fighting COVID. What are the three things you would do differently to fight the current situation? And please also elaborate three things you would do differently as an individual as well. Another related question is, how do you evaluate DRDO's medicine, which drastically reduces need for oxygen support and likely impact it will have on the pandemic and our logistics requirement? Thank you, Doctor.
Deepak ji, three very loaded questions. I hope I'm able to do justice to these. Okay, so if I am Supreme Court appointed committee, well, it's a sad day when Supreme Court appoints a panel to manage a pandemic. And, Supreme Court has just appointed a 12-member panel to look at oxygen supply. It's really, really unfortunate that we are short on doctors, and we have taken some of our best doctors and told them, you play oxygen, you decide who will get oxygen. It's a really sad day for us. And frankly, these good doctors know about medicine. What do they know about oxygen supply chain and logistics? So, if I were the Supreme Court appointed panel, I would break my question down into two parts. If the Supreme Court had appointed me before this wave came, then I would say, keep your eye on the ball. Every country that has had a wave before us is having a second wave. We are likely to have one too. So don't dismantle the large facilities that you had built to take care of COVID patients just because you had no COVID patients for 3-4 months. Keep them there. You may need it. If more people are going to get infected, do we have sufficient stocks of medicine? Do we have sufficient stocks of oxygen? So I do believe that India, I'm not an expert on this at all. I have read somewhere that India makes enough oxygen. It's just that it doesn't make it at a point where it is needed. Oxygen is made generally close to places that have steel plants, which is because India uses oxygen in the steel industry. And only about 10% or so is used as medical oxygen. So it's really a case of transferring oxygen from one point to the other. And we did not have enough containers to do that. Most people don't realize that oxygen cannot fly on an airplane. It has to be transported, by road. So those are the logistics I would have worried about. But if I was appointed as the committee once the second wave hit, then my entire focus would be on saving lives. How can I save lives? How can I make sure that people who need to be in a hospital are in a hospital? And you have good examples in Maharashtra and Kerala where you have really war rooms which are sort of telling people where to go. how to distribute in hospitals. Haven't seen that happen in many other parts of the country. Uh, so really, it's a war, and take it at a war footing. And so that's really what I would do. Try to save lives and vaccinate at scale so that I can avert future disaster. The DRDO medicine, the DRDO medicine is, and if I can go back to my biochemistry roots, the DRDO medicine is an inhibitor of an enzyme called hexokinase. And that enzyme is used in a process called glycolysis. Glycolysis is a process of quick energy generation in the body. The logic here is that infected cells, as also cancer cells, need to metabolize and generate energy very, very quickly. And that's why this would be effective. Yes, virus infected cells do require more energy than non-infected cells. And I hope this drug works because certainly the trials that have happened so far are on very limited numbers of people. And the trial also did not have a primary endpoint, which sort of worries me that, how can you have a trial without first deciding what would be the primary endpoint of the trial? But nevertheless, this is a tool that we would be deploying on people who are very, very sick. And this would be unlike a vaccine which you give to healthy people. A drug is always given to people who are very sick. So let's hope it works. I cannot predict how much it will help in alleviating the problems in the second wave, but I do hope that it will help.
Thank you, Dr. Jameel. I'm aware that you have to go very shortly. We'll just squeeze in the last question from the audience. Sujasha Paul, are you there? Please go ahead.
Yes, can you hear me?
Yes, please.
Yes.
Hello, good evening. I'm Sujasha from Vadodara. So I wanted to ask you two questions. The first one was about the plateau that we were talking about initially in the session. So there's been a delay in COVID test results as labs are grappling with the surge. So I wanted to know that if this lag has any bearing on the plateau that we seem to have hit. And the second question is, why isn't the government ramping up genomic sequencing and collaborating with scientific advisors to understand the transmissibility and infectivity of the virus better? Thank you so much.
Right. So your your first question, yes, it could be because of that. Many places testing is not happening at all. In other places, testing is happening, but results are taking 10 days, 12 days to come. So what we may be seeing is really sort of a false plateau. The numbers may have stalled, not because they have actually stalled, but because there is less testing. And if you look at data over the past few weeks, you will see that testing has increased at a much slower rate than the cases have gone up. The test positivity rate of India is roughly 22%, which means that every fifth person in the country, if tested at random, is positive. And so it could simply be that the numbers have stalled because of testing. On your second question, I guess I can say a little bit more because I have more inside knowledge of it. The government did set up a group called INSACOG, and INSACOG stands for the Indian SARS Consortium on Genomics. This is a grouping of 10 national labs which have the capacity to do high throughput sequencing. And they have been brought in with the sole purpose of stopping all their other genomics work and focus entirely on sequencing COVID cases. This consortium was set up in mid-January, and the labs came together and started working sometime in early to mid-February. And since then, roughly 20,000 genomes have been sequenced. We know how 617 is dominating in the country. We know how 117 came up, but it's not now going down in the population. It is this grouping that first saw 617 emerge in Maharashtra. It is also this grouping that is now showing the 617 lineage to be diversifying into three different lineages, sublineages. And one of those three sublineages has now been called a variant of concern by the World Health Organization. So yes, this grouping has done valuable work, and it has provided evidence to policymakers to make policy accordingly. So when this consortium was set up, the idea was to sequence 5% of daily cases. But remember, 5% of daily cases at the time of setting up were, there were 20,000 cases per day. So 5% of that would be 1%, would be 1,000 cases per day. The total capacity of these labs is about 1,000 cases per day, 30,000 cases per month. In today's time, when you have 400,000 cases per day, it's just beyond the capacity. The country doesn't have that capacity. So we may have a vision and aspiration to do 5%, but we just can't. We don't have the machines, we don't have the manpower, we don't have the reagents. So that has to be understood. So the point is that a grouping is there, a grouping is providing valuable information to the government. The grouping is also in a position to say what are the variants that are emerging now, which may become a problem tomorrow. The grouping has already provided evidence of what is causing breakthrough infections. And this is already out in a publication that was uploaded in the public domain yesterday. So yes, I believe the grouping has been able to do all this, and it has been able to do all this in 2 months. Yes, we can always do more, but let's look at the glass that is half full. We'll have opportunity to fill it more.
Thank you, Dr. Jameel. I think we'll have to, end it here. Thanks everyone who came in. Thank you everyone who asked questions. Unfortunately, a lot of questions we couldn't take. There are almost like 300 questions on the board. A lot of them have been answered. There were multiple people asking similar questions. So thankfully those have been taken, but a lot of them could not be taken. I apologize for that. And thank you, Dr. Jameel, for finding time and sharing your perspective. I'm sure it was quite.
Well, Amitabh, if you allow me, can I have a last word?
Yes, sir. Please, please.
Yeah. So, I don't think I came out forcefully enough to say a couple of things.
Yes.
One is, no matter what, whether you get a vaccine or you don't get a vaccine, whether you are in favor of getting a vaccine or you're against getting a vaccine, please, for your sake and for the sake of everyone around you, wear a mask. And wear a good mask, and don't wear it on your chin, wear it on your face, and wear it such that your mouth and your nose is covered. And the second thing I would really like to say is that, this pandemic will be over. We don't know when it will be over, but believe me, it will be over. But when it is over, don't forget that it was doctors who saved us. It was science that saved us. How did science save us? Science saved us because it developed vaccines in record time. It had never been done that vaccines were available while the pandemic is on. This is the very first pandemic in human history that we are trying to control with a vaccine. That was developed because somebody had the good vision to fund science at some place in the past. So when this is over, don't forget that doctors saved you, that science saved you. And therefore, it is important to train more doctors and to fund more science. So I would just leave with that plea that understand that, and also understand that science is a way of doing things. If I, as a scientist, say today that masks should be worn, and if the evidence tomorrow says that masks are useless, you can avoid them, I would have no hesitations, saying masks are useless because evidence points to that. Scientists are possibly the only community that likes to be proven wrong, because if we are proven wrong, that means that the field has moved forward. There is more data, there is more evidence. We are guided by evidence. We are not guided by our beliefs. So the rest of you can believe in us. Thank you.
Thank you, sir. Thank you. I think it's very useful for everyone listening in also. And so finally, we'll have to end it here. Very special thanks to our partner, Plutus IS, who are helping us make this possible every time. So thanks to them as well. Thank you everyone for joining in. I hope you found this useful. And thank you for taking time and making this successful. Thank you.
Thank you very much.
Thanks.